the talk will be about harnessing neurodiversity in daily life, school, and work. And my background is in neuropsychology and clinical psychology, and also with the crossover towards educational and vocational types of endeavors. And this is the background that I have that I would be bringing to this presentation. So these are I'm going to start with some questions for you to bring the topic more to your personal or family or work or school experience. And I am not going to, of course, give you answers because, we have not done any assessments or we didn't even talk. And I cannot even see most of you. So one of the questions would be, are you a visual learner? You actually have to see a book, a text, or your phone or computer. You're more auditory learner. You're actually doing well when people talk to you or listen to lectures. Or you're more of a kinesthetic sensory learner. And that is, you actually have to move your body and you have to, sense, the experience in some way that appeals to you. And I'll give you an example. A long time ago, I actually had a client who had difficulties learning in her anatomy course. She was taking an anatomy course in one of the health disciplines, and she had to learn the names of all the muscles in her body. And she tried the verbal techniques, she tried the auditory, she tried the visual. And actually the best method that we came up was when she was drawing with a felt marker that she could erase on her own body. Where these different muscles were, color coding them. And she said she learned in no time when she could feel it in her own body where these muscles are. And that would be more a kinesthetic sensory learner that we are dealing with. Do you focus best? Do you concentrate best with music on or in quiet? Some people, and especially many teenagers, claim that they actually focus best with music on. But you may have a preference for music or no sound at all. How do you handle sudden changes in environment around you? Like for example, if you heard a really loud noise, just behind your door, what would you do? Would you jump? Would you go and check? Or you would think, well, that cannot be anything serious. Do you react quickly? Sometimes too quickly. We call it, that's not necessarily the best language, but we call it impulsively. And that means quickly, but with a higher likelihood of making errors when you deal with everyday situations. Or you're actually more of a reflective type. You take your time and other people say, hey, move on. But no, you actually need more time for thinking, or your family members or other people are in a similar situation. These are more scenarios that you may encounter rather than necessarily your personal preference. During a disagreement, your partner may withdraw in another room when you still want to talk. A while ago, again, when I was doing more family or couples counseling, this was a very common theme. Why is he not talking to me, but actually removing himself or herself to another room? So that's another scenario of showing, neurodiversity. Your child cannot concentrate on homework, but can play video games for hours. How is that possible? They can stick to it 3 hours, 4 hours. I think I had a record-breaking teen who was saying, he was spending 8 hours. I don't know how he managed to get 8 hours of a day, but that's what it was. Your new date, if you are in sort of a dating environment, your new date seems interested in you, but does not pick up subtle social cues like you're checking your watch or checking your phone or sort of looking distracted around. And does not reciprocate when you have some friendly overture saying, you know what, I just you promised some so-and-so to be home, you know, by that time. So that could be a maybe not so subtle social cue. You like to plan your travel and sightseeing in detail and stick to it, but your companion likes to be spontaneous, say, hey, let's not pre-plan because it just feels like I am thwarted by all these plans and there are barriers and they are not helping me. What do you like? Do you like walking peacefully on the beach, assuming a nice day, but your friend insists on skydiving and some thrilling activities? Another example, your family member takes hours to do their simple but tedious paperwork, but you can come up with creative solutions. But he can or she can come up with creative solutions to your home's design and renovation in no time. So, you know, paperwork, preparing some billings, taxes, payments, that takes forever. But innovation, no problem, right away. So what is neurodiversity, given some of these diverse examples? Well, we need to look at brain as a unique fingerprint. Not everybody's brain is the same. Neurodiversity reflects differences in the way our brains work and reflects variations in how your brain functions. Despite, you know, general, you know, anatomy being similar and, you know, taught in medical school and healthcare courses, but the function and preferences and pathways and ways of thinking, learning, and behaving may be different. So the question is there a correct way of thinking, learning, and behaving, and everything else is incorrect or non-normative? So I wanted to bring up the idea of neurodiversity contrasting with what we call a medical model. You know, what is a medical model? We are looking at someone with a short attention span and difficulties with planning and organization as someone who is having deficits. It's pathology. It has a name in the diagnostic and statistical manual of mental disorders or some other, you know, medical textbook. Whereby neurodiversity actually sort of normalizes these differences and points out to, yes, these may be vulnerabilities and problems, but these are actually strengths that can be capitalized upon. And that's a novel way at looking at how we think, how we learn, and how we behave, because we are all really, you know, trained in the medical model. If not, I would use a blunt word, brainwashed with the medical model, because, you know, this is how our entire healthcare system operates. You don't go to get help from your healthcare system with your strength, not very often, but you go when there is a vulnerability that you want to have addressed. So this is actually a brain fingerprint, which is a logo of the company that I am involved with, Cortex Center for Advanced Assessment. And it shows you, you know, the complexity of that fingerprint and how unique it is. And probably is very unique for each one of you. So neurodiversity is different from this pathology approach that I just mentioned. All brains have strengths and vulnerabilities. What's important to remember is that neurodiversity does not equal disability. There may be some aspects of neurodiversity that can ultimately be disabling if not appropriately treated and accommodated, but not all neurodiversity is disability. Strengths and talents we have can be harnessed, and vulnerabilities can be accommodated, compensated for. Strategies can be learned how to manage them. And neurodiversity is not sort of a black and white, you know, dichotomy. It actually is a continuum. You know, we can, everybody can be actually seen as neurodiversity. You and I can be neurodiverse, but, you know, some are more neurodiverse than others. There is a pattern to their neurodiversity that we might have learned from research and clinical practice. And I will talk about some of these that are better researched. But as I mentioned a moment ago, a healthcare system is built on the medical illness model. So you are not going to hear the term neurodiversity a whole lot. So what are some of the examples? Typically classic examples given in the emerging literature on neurodiversity is ADHD, attention deficit disorder, autism spectrum disorders, learning disorders, whether it's reading disorder, writing disorder, or math disorder, or all of them, or some of them, or partially some of them. Giftedness is also an aspect of neurodiversity and can go together with many other aspects of diversity. Someone may be gifted but have a learning disorder. Someone may be gifted but is on autism spectrum. Anxiety is also, probably not intuitively, you wouldn't think that anxiety is a neurodiverse condition, but it actually is, and I'll show you some research about it. Bipolar disorder, there are many different types of bipolarity. Bipolar 1, which is sort of milder, does not have a psychotic component. Bipolar 2, and there is cyclothymia, which is a variation in mood that does not meet the criteria for bipolar. Many of us are using the term, oh, I am such an OCD person. Yes, obsessive-compulsive symptoms. We will talk more about them. It could represent neurodiversity as well. And something that's not even represented in any book called cognitive style. And you may think about it. Are you more on an impulsive side when you respond to problems or issues in your everyday life? You respond quickly, but you can make mistakes, or you're more reflective and you take your time to consider all the issues, options, analyze, sometimes maybe even overanalyze, but it's a continuum. So on one end, we have very impulsive people, and on the other hand, we have highly reflective people, and most people fall in the middle. So it's not black and white, but it's more of a continuum. So I would start with ADHD. I understand that last year there was a whole presentation on ADHD, and I also understand you can still find it on BCPA YouTube channel. So I would encourage you to do it. I will just very briefly highlight this from a more neurodiversity perspective rather than purely pathology perspective. So I put down a question mark with the ADHD epidemic. And why is it so? And this is because the referrals for ADHD assessments never end. I don't know why. Since COVID, we had probably doubled or tripled the number of requests and referrals related to ADHD. So hence, is it an epidemic, or people are more aware of it, or people actually have other conditions, but they think they have ADHD because ADHD is sort of more in fashion now than it used to be. Well, let's talk about it. What I brought up here, which you will have access on YouTube, is a very popular World Health Organization symptom checklist for adult ADHD. So I am not going to read it all. You can access it. But what I wanted to mention is that this particular checklist consists of two parts. This is part A. There's also part B. With part A, if you have 4 of these symptoms, it means you pass the screening for ADHD, or someone you care about or might have an ADHD, but this is just purely a hypothesis. We don't know, but if someone has 4 of them, hey, we need to do a little bit more work on assessing it. If you don't have 4, then you don't need to worry, although of course, need to have other information as well. So the examples of questions in that most important part A is, do you have difficulty getting things in order or organizing things? Do you remember appointments and obligations? And yes, many people would have strategies for, writing things down, putting things on their cell phone. But despite doing it, is this still an issue to a degree? When you have a task that requires a lot of thinking, do you procrastinate? Do you avoid or delay getting started because you're just thinking too much about it? How often do you fidget or squirm with your hands and feet? We cannot see each other, whether we do it or not online, but certainly in person, very visible. How often do you feel overly active, compelled to do things as if you were driven by motor? So we need 4 of these items answered yes or likely yes. And then there's a whole list of other issues that may come and be part of this diagnostic spectrum. I won't mention all of them. The examples are making careless mistakes, keeping attention when you're doing boring work, being distracted, restless, fidgety, finding yourself finishing sentences of other people. That's not the greatest social skill, but actually people with ADHD do that. Difficulty awaiting turn when turn taking is required. Interrupting others. There's no specific number, of answers that you have to have for it, because it's just supposed to complement part A. So you have more information about issues that you encounter. So let's say someone answered a lot of yeses on part A and B, and now what do we do? Well, we of course need to do a proper assessment, because screening based on self-report is not sufficient to provide a diagnosis. Although in a big hurry, our overloaded healthcare is doing it very often. You can be told, or your loved one or a friend can be told, hey, we can do it in half an hour. I tell you, you have ADHD. Well, I practice in neuropsychology, and as a neuropsychologist, let me take a risk and tell you, no, you can't do it in half an hour. No, you can't do it. You may hypothesize that someone might have it, but you actually need to see this individual, do some tests, talk to people who understand and know this individual on a daily basis. And when you have all this information, pull it together and see whether you're dealing with ADHD, what kind of ADHD, what is the severity of this ADHD, does it even meet the criteria? Once this is done, and assumably someone is on ADHD spectrum somewhere. I call it spectrum because it could be any level of severity, and could be partial symptoms, all symptoms, and so on. Well, what do we see at a functional level? Like, the title presentation today is, impact on daily life, school, and work. Well, what we see is difficulty in studying subjects of low interest, a distractibility, getting off track. So if someone has no interest in science, they will find it very difficult, to study science. But if they are passionate about business or art, they will actually be able to focus most of the time. Responding quickly and making mistakes, the very impulsivity we just talked about, is a frequent feature of functioning with ADHD. Impatience, giving up when the going gets tough. I don't know if you've seen people say, I can't do it, I am not that smart, and oh, I made mistakes, I am not, going further with it. Impatience, giving up, impulsivity, and impulsivity sometimes comes with risky decision making. That you think, couldn't they predict that, this situation will actually end up in an accident, or in some negative social situation? Well, obviously, if someone is thinking impulsively, they process information quickly, often too quickly, and they make risky decisions that then don't work out. But this does not mean that they cannot learn from these risky decisions and their negative consequences. Procrastination, poor planning, time management, everything may take too long because there is just so much processing of information involved. And if it is done quickly, then there could be a lot of errors and making mistakes, being late for appointments, forgetting important instruments that are needed, or even glasses for an appointment. Organizational problems, boredom intolerance. People with ADHD on the ADHD spectrum seek stimulation a lot. They get bored. They cannot handle monotony. So they always have to find something exciting. And when they find something exciting, and maybe are also at the same time risky, so can go that way too. And the research shows that because of their history of difficulties in daily living, school, and work, they start curtailing or decreasing their ambition. Their academic and career aspirations go down, and they don't as often go into a university. They don't trust themselves, and their confidence is down. So these are all issues that may be encountered and more. But what are the strengths in ADHD? We're talking neurodiversity. So I don't know how many of you actually worked or dealt with people with ADHD, but they're very perceptive. When I work with people with ADHD, and I don't happen to have it, I notice that they can figure out things faster than me. Where something is needs to be quickly perceived, something out of whack, something out of order, or there is some strange occurrence happening. They're very, very quick. They're also quick to process information and react, and they can do with appropriate training really well in emergency situations. In emergency situations, you don't want someone who is overly reflective, because they will think so much that it will kill the solution to the situation, because they just won't be able to figure it out fast enough. Here is someone bleeding, you cannot go and open a medical book and check bleeding, what it can be caused by, 1, 2, 3, oh, there is another page about this. By that time, the patient may be very sick. So that's why that quickness and reactivity can be harnessed. People with ADHD can be creative and innovative. They can hyper-focus on tasks of interest. So as long as they have a career and a job, or they study a course or program, or they are passionate about, they will perform well with that hyper-focus. Although they may get tired from hyper-focusing for too long, but they still, it can be harnessed. The key issue is being aware of the strengths and weaknesses, because that would enhance performance. And I have not assessed any of these people here personally, so, but this is apparently, according to Dr. Google, are individuals who have ADHD, but I cannot really guarantee this. That's just Dr. Google, not me. And you probably know more about these people than I do, so I'll just move on. Autism spectrum. I'm not sure if you recognize this middle-aged man, it looks like with some Italian background. This is Michelangelo. You usually remember his portraits from older age, but this is him looking younger here. And I very quickly go over autism spectrum types of issues, separately for children and separately for adults, because you watch out for somewhat, there's similarity, but there's also watching for some other issues that may developmentally not present themselves yet, or that for that long. So what we see in children is delays in speech and language, difficulty understanding nonverbal communication and emotional expressions, poor eye contact, poor social reciprocity. You smiled at the kid and the kid is somber or even bursts into tears. It is this distinct disinterest in social interactions, unable to connect socially, difficulty making friends, friends, push him or her away. There are significant signs of repetitive behaviors, rigidity, some stereotype behavior, and poor ability to adapt to change and preference for sameness. So if there is a change in the environment, mom's had a new hairstyle, or there is a new furniture at home, or there is a substitute teacher coming, and other kids are sitting in different places than in the past. These are all issues. And then sensory hypersensitivity, especially with respect to touch. You may be tempted to hug the kid because you feel, well, they're probably shy and they don't want to talk to me, so I'll hug them and they will reciprocate. Not necessarily. They may not. They may actually respond by moving away and not wanting to interact because they're hypersensitive to touch. In adults, what we see is anxiety in social situations and avoiding social situations. People on autism spectrum are often loners. They prefer to be by themselves, very definitely. They have usually a large range of activities they can do all by themselves. They have difficulty making friends, just like they had when they were children. They seem distant, sort of insensitive, or even blunt. I once had a client on autism spectrum who asked me, "Why are you asking me so many open-ended questions? Ask me, yes or no questions." I thought, okay, well, yeah, I can do it, and that was probably a very good feedback. But it was said rather bluntly. Difficulty understanding their own and other people's feelings and decoding social cues. Most of our communication, social communication, is actually nonverbal, and nonverbal communications are typically more powerful than verbal communications. And this is the very area where difficulties are. And there's also difficulty handling changes and novelty, just like I mentioned with children. The impact on function, few or no friends, relying on familiar people and significant others, problems with social aspects of school and work, easily overwhelmed, stressed, and anxious and frustrated in social environment. It sort of descends on them like that dark, overwhelming cloud that they don't know how to handle, how to deal, with someone who, tease them or use a sense of humor that they found strange or not understandable. They don't know how to reciprocate, trouble adapting to new people, may not like open-ended questions, just like the client I mentioned, and may have uncommon interests and hobbies that are not easily shared. And if you have very unusual hobbies, then you don't have anything to talk about with most people. So can we harness these strengths in autism spectrum? Obviously, yes, we can. We capitalize on intelligence, talents, and giftedness that this individual has. Then we help them develop unique skills and expertise in the area where they have cognitive strengths. And these areas need to be minimized with respect to social demands. So I apologize for stereotyping a little bit, but there are some areas where social interaction is not absolutely pivotal for success. And that could be science, math, engineering, technology, computers, linguistics or different theories, art, research, although we want interactions in all of them. But if you don't want to interact, you can actually be successful as well. That you will not find it in literature. In working with clients on the spectrum, I noticed how honest they are. They do not know how to manipulate people, how to control people, and how to lie to them to achieve their goals. They are very honest, even if it actually is not to their advantage. This is an example of a drawing. I don't know how you like that drawing, by a 21-year-old fourth year mathematics student diagnosed on the autism spectrum. And I just love this picture, the detail, the precision, and how it's all positioned is just absolutely beautiful and amazing, and shows how this talent can be expressed in a mathematical mind, also on an artistic side, and which we need to find. So autism in famous people, again, I never tested any of these people, and some come with question marks, but there are some very famous names there. Michelangelo, Darwin, Einstein, Newton, and some more modern people. I have not assessed them. I don't want them to complain that I mentioned that they might have something, but it's just Dr. Google, okay? Anxiety. Are we wired for anxiety? That's the question. Is our brain actually wired for anxiety? Because if some people seem to be more anxious than others, even since childhood, and anxiety can be an adaptive response to a perceived threat. There is a reason why we get anxious, so we can avoid dangerous situations. We need to divide it between state anxiety in a given situation, just before the exam, or a complex surgery you're supposed to undergo, versus trait anxiety, which is being just generally an anxious person and reacting in an anxious way. It may reach the level of disorder, and then it could be called panic disorder, phobia, generalized anxiety with lots of warnings, and social anxiety. And there will be a separate presentation on social anxiety this month. So this is just a famous version of Booth's scream, illustrating panic, impact on function, increased discomfort and avoidance. People may become emotionally paralyzed, shake, tremble, panic. Their cognitive functions are affected: concentration, processing speech, short-term memory, and executive functions. They may have difficulty with productivity, and they also get tired. They have significant mental fatigue because managing all these anxieties is exhausting. When you think about it, if you think last time you were anxious, I don't think you probably would be super successful in preparing some sort of an important group presentation, because that anxiety would interfere with the efficiency of your thinking. How can we harness anxiety? Well, people who have trait anxiety, the general anxiety, tend to be sensitive to emotions of other people. They don't want to hurt them. They could be empathetic, compassionate. They want to have trusting and secure relationships, because this is the this is an opposite to being anxious, right? So they avoid needless risks. They may be cautious and conscientious. They may cooperate with your guidance, direction, or other people's guidance. And they build a lot of self-awareness. I don't know if counselors would agree with me, but some of the most quickly progressing clients are those with anxiety, because they're so anxious, to actually do all the right things to get rid of anxiety, that they actually do get rid of anxiety when they have appropriate support and guidance. Bipolarity, well, again, no assessment of these individuals, but are some famous names: Hemingway, Van Gogh, Churchill, and some more contemporary figures. You can find them with Dr. Google too. So there are different types of bipolar disorder depending on severity and types of symptoms. There could be also an aspect of variability in mood and emotions that's called emotional lability. So these are people who have quick changes in mood, and you tell them something happy, they smile, but then they watch a sad movie and they will cry immediately after. So that may be part of a broader scope of bipolarity. It's difficult to differentiate ADHD and some personality issues from bipolar conditions, especially in young people. And we have what is typical are the episodes of mania or hypomania, which is doing too many things in a little time, and being overly energetic, speaking too fast, and having too many things on the go. And depression, which would be low energy, low mood, and actually difficulty getting out of that low mood, more so than in other conditions that are called depression. What is the functional impact? Well, the problem is that can be unpredictable because that depends on the episode. Is it manic, hypomanic, or depression, and how it presents itself. So for mania, hypomania, we have excitability, high energy, fast thinking, concentration problems, restlessness, overactivity, almost like sort of ADHD-like agitation. May have also psychotic problems. They may, hear things or see things as well. And depression, lack of motivation, negative bias, seeing everything negatively, withdrawal, passivity, can produce low productivity and absenteeism at work. How can we harness? That's a tough call. Is this even possible? We know that treatment of actual bipolar disorder is a priority, so we have to use a medical model to a degree here. We need to define the type of episode and how well the individual is recovering. I had clients with bipolar who had 20 years before their episodes. So they had episodes early on in life. Then they had 20 years functioning just fine, no thank you, medication not necessary. And then they would have major stress. In the cases I remember, these were accidents that they had that disrupted their routines and created a lot of stress, and the actual bipolarity would return with some episode. In a hypomanic state, people show high motivation, ambition, productivity, creativity, innovation, very unique insights and ideas, and fearlessness. And these features can be channeled and extremes prevented. Just, when I showed you the names of people who, supposedly have bipolar conditions. Obsessive-compulsive issues, there's obsessive-compulsive disorder, and also personality features that are OCD-like, but they do not meet the criteria for OCD. Obsessive thoughts, thinking about, something negative constantly, about wanting to do something, very often, socially unacceptable, but also, obsessive thoughts that can be socially acceptable, such as cleaning, but to an extreme, or organizing things to an extreme. And the same with compulsive behaviors. It could be, they typically involve excessive cleaning, excessive order, excessive organization, and fear of contamination. They could be different manifest and checking behaviors. I had a client who who happened to be a bus driver, and he was checking his bus before taking on his job for a day for about 3 hours, even though it was already checked by a mechanic, and that he had a classic obsessive compulsive disorder. And we had to work very hard on his symptoms. Typically, this requires a very intensive type of therapy. The most effective therapies are actually daily therapies for significant OCD, not for a mild one. However, there is this excessive conscientiousness and proneness to guilt as well that we need to consider. And we know that there's brain research on people with OCD, and it shows excessive activity in the frontal region of the brain, which are responsive for these intrusive thoughts about what people need to do or have to do. and high anxiety that accompanies these thoughts. And it's also, the research shows imbalancing between neurotransmitters that are involved. So it could be more of a hidden neurodiverse condition. You can, argue that actually that's pathology. But, the research on brain and the fact that we can harness, some of these aspects is important. So the impact on function, people with OCD features will love structure, sameness, organization, cleanliness, and order. They get tired because of these intrusive thoughts running in their head. They may be not as productive because they are so busy, doing things that are repetitive and not necessary. They may have good insight, but they may also have weak insight. And if they have weak insight, they actually think that what they are doing is the best thing that they can do. And they may have a negative impact on other family members, because other family members, they feel under pressure, that, this particular glass of water has to be, put somewhere in a very specific place. And they just put it in a wrong place, and that causes an argument. Or that, there is a little speck of dirt on the floor and it needs to be immediately cleaned and, very intensely. So there's a negative impact on others. How do we harness? Treatment first. The underlying conscientiousness actually is a good thing. It can be harnessed. There's lots of research that conscientiousness predicts positive career outcomes. Teachers and employers really like conscientious people. And a conscientious individual under stress may become a little bit OCD-like, but a conscientiousness by itself is actually a desirable characteristic. Then this persistence or order, organization, cleanliness are very socially desirable. And, in many jobs, you would actually want to have someone with OCD characteristics. You want to fly on a plane and, knowing that the airplane mechanic did everything by the book and, everything has been checked out and your surgeon knows exactly where to go and where not to leave their instruments behind. So, yes, that it is possible. So now I'm starting wrapping up. How can a neuropsychologist or psychologist practicing in the area of neuropsychology, which is about brain behavior interaction, how can we help? Well, first of all, we can do very customized assessments with objective testing of cognitive, emotional, behavioral aspects of neurodiverse conditions. Because self-report, someone telling you, oh, I have an SD, I have an ADHD, that's not a replacement for objective testing. And you may actually have an erroneous diagnosis and erroneous treatment arising from it. Then identifying the profile is important, not just do you have it or you don't have it, but rather what are the strengths and vulnerabilities, and how can you use strengths and vulnerabilities to offset some of the issues that get in the way of functioning. We can provide guidance regarding treatment and further referrals, determine impact on daily living, school, and work, recommend how to modify activities, schooling, work accommodations, school accommodations, compensatory strategies like for memory and concentration and executive functions, planning, organization, how to capitalize on strengths, and provide educational, career, personal guidance, enhancing self-awareness, empowerment, improve stress management, coping skills, planning and goal setting, and that's typically helpful. Feedback to clients and significant others if the client wants, family members or a close friend to participate, it's their decision. Consultations and teamwork with other professionals. So if there is, let's say, a doctor who is prescribing medication for ADHD, again, we can provide more details about the nature of this condition, how it can be offset, and the severity of it. Provide written reports for schools employers and insurers. We go to court if necessary. We need to remember that no one size fits all in service. And there are many different types of services you can request, like brief cognitive screening, brief consultations, more extensive clinical diagnostic assessment, especially when there's lack of clarity or potential multiple diagnoses, which are much more often than one thinks. And if this is a medical legal evaluation for court purposes or insurance purposes and so on. So the take-home messages, neurodiversity represents individual differences, is best understood in the context of strengths and vulnerabilities and implications for daily functioning, school, at work. Treatment, accommodation, and compensatory strategies are priorities, but we also need to capitalize on strength, and we often act under the medical model and forget about the strength. We should not let health practitioners diagnose these neurodiverse conditions without objective testing, with ADHD being a good example. There is a proliferation of a 15-minute type of evaluations. Neuropsychology research and practice moved very much beyond the traditional areas of practice, which was traumatic brain injury and stroke or dementia. Not anymore. We now know that many of the conditions we discussed have a neuropsychological dimension, which needs to be well understood to plan future goals in daily life, at work and at school. And self-awareness are essential because this way you can create a balanced and successful life, promote mental health by destigmatizing issues. So neurodiversity is a destigmatizing operation and concept. So that's why I focused on some of the strengths as well. And psychologists practicing in neuropsychologists focus on brain behavior and the impact on function and harnessing neurodiversity by providing assessments, reports, and consulting. And if you're interested in how a test of attention might want to look like, you can go to the website of Cortex Center for Advanced Assessment and click on that particular link that you have here, and you will have a sample online test of attention. It's very, very basic, and it's only one type of attention. There are multiple types of attention, but at least you'll have a flavor for what could be done. And I would like to thank you for your patience and open it for questions. And this is how we can be contacted.
All righty, Isabella, wow. That was pretty good. All in, what's that been? Just under an hour. Okay, hopefully you can stick around because
I am sticking it out.
Oh, yeah, there's lots of questions here.
Wonderful.
I think the biggest question that, because we're two people who wanted to know about this one in particular, but I'll also sort of go through some of the other ones. The difference between, because autism is usually seems to be measured more in men, but we've found that there are differences in women and how they present autism, ASD. So just wondering if you would like to comment, and these people, both of them seem to be more interested in how does autism affect women differently?
Well, again, this area is still under research. What we know about autism in women is that women in general, regardless even of autism, tend to be more influenced by social expectations, how to behave and how to act, how to be nice, how to be compassionate, how to be empathetic. I am using all the stereotyping about women I can come up with. And therefore, when you have a girl growing up with autism, there may be more visibility of some of these social issues. If there is a boy who presents with some, significant stereotypical behavior or even aggressiveness, it's considered to be boys do it. But for a female, that would be not very acceptable. So that picture that I showed you of the whatever insect that was on that artsy picture was actually produced by a female on autism spectrum. And the way she was recognized initially, I've known of her childhood, was very quickly. But what happened was over time, even though she learned to compensate for her autistic types of interests and behaviors, she started withdrawing socially even more because she acquired more and more. Now she's in university, has no friends because her friends find her strange. And in elementary school, the teachers were working hard on having her accepted and accommodated. They were giving her special projects in which she could shine. And it was not as difficult for her to manage. And, she could conceal certain aspects. But then when she started moving towards adolescence, and she actually said that she hated going through adolescence. She didn't want to, that she was sort of her parents tried to prepare her for adolescence. I don't want to be an adolescent. That's a change, right? So she couldn't handle that change, but also more social expectations, and then more social expectations in university, because now there's less individual accommodation. There is accommodation in university, but probably not in the type of courses you take, or what the content that you have to cover. And the university class will not be prepared for a fellow student with autism, how it would be in elementary school. So she became much more affected on a social side. It was interesting because on a social side, she was more and more affected with age, even though some unusual behaviors were presented. But hey, children can do all sorts of things. But on the other hand, she excelled in her actual academic aspects. Right now, she's only 21 and she's in her 4th year and planning doctoral studies. So diverse path, getting sort of more sensitive on a social side and more withdrawn, spending more time in her room, but then excelling academically, but not praising herself for it, because she does not have that sense of, well, yes, I am doing really well. So she thinks it's sort of normal, everybody, should be doing it. So I know it's a case example, but, I know this case really well. So that's why I wanted to use it. And I wanted to say is that we need more research on gender differences, because we tend to see more females with more inhibitive types of behaviors, withdrawal, avoidance, and more boys on the autism spectrum with more like outgoing in a negative way type of behavior, aggressiveness or bluntness or bizarre behaviors. But this is also not atypical for other conditions. Other conditions also, affect genders differently. But, we, of course, there's more work that needs to be done on it, especially given that autism spectrum is a spectrum. So can we compare someone who is mild to someone who is moderate, someone who is severe, and then someone who is on autism spectrum, but also has ADHD. I had a client who was on the autism spectrum, had an ADHD, has OCD, and had generalized anxiety disorder and depression, 5 diagnoses in one. This is how complex these scenarios can be. So how do you do research? You want to have someone who has pure, what I would call pure spectrum, autism spectrum, but it has to be also mild. And to find enough people of similar level of functional impact, it's very hard. So, I really appreciate these questions, and I hope that there will be more research. But in the meantime, there's a lot of the clinical case studies.
Okay. There's a couple of people asking about some other lesser known issues. So I'll just list a bunch of them. And if you want me to cue you again about them, you can.
Yeah, okay.
So just comment on the ones that you know and would like to comment on. So Ehlers-Danlos, hypermobility, misophonia, environmental sensitivity, and giftedness. Are there any there that you would like to comment on?
Okay. Yeah, well, again, I would probably rather comment on the area that has most researched, and that's giftedness.
Okay.
The other area, well, the hypersensitive, what was the, before giftedness, there was one.
Yeah, there was environmental sensitivity.
Environmental sensitivity, yeah. Again, I would say that conceptually, except for giftedness, that has been, well researched, hyperphonia and environmental sensitivity could be an aspect of actually a number of conditions. That, yes, they do reflect diversity, neurodiversity, but for example, I work a lot with people who had concussions or brain injuries, and these people, will have hearing sensitivities. They sometimes have to wear, protective devices because they hear everything too loudly. And it is also, not uncommon in other brain-related conditions. So one can research it separately out of the context of a condition, or it can be researched within that condition. And this is why the research on it, may be limping somewhat, because there is no agreement on how to best research it. Environmental sensitivity. I mentioned already that, for example, people on autism spectrum may have sensitivity to different stimuli, whether we can call it environmental or otherwise. There is a sensitivity to stimuli. It could also, be present in conditions that are called, for the lack of a better medical term, multiple chemical sensitivity. Sometimes it's a part of it. For example, I remember a client who came with chronic fatigue syndrome and fibromyalgia, who walked into my office, and he said, there is someone ate a banana here. And I didn't know there was any banana in the room. And he went to the garbage can, opened it up, and he showed me that actually there was a banana peel there. So, and he told me that he can sense when he is in the gym, he actually cannot go to the gym because he is so sensitized to the smell of chlorine in the swimming pool, which is actually, quite a distance from where the gym is, but in the same building. So that's just, again, example, and we need more research on it. And I would say, more medical research on that environmental sensitivity, because historically, neuropsychologists are looking more at the cognitive aspects, and medicine was looking more at the sensory aspect of it. Okay, so that's why I was talking more about cognitive aspects. So going to giftedness, again, to be really quick, we actually have quite a bit on giftedness on our website. We have a definition of giftedness, what is important in terms of giftedness is to understand what kind of giftedness we are talking about. Are we talking about giftedness in terms of very superior intelligence, which would be 2 or 1 top percent in the population of individuals who are being assessed? That is called intellectual giftedness. And those of you who work with school children or have school children, if someone says giftedness, that's for sure, the school typically means, yes, they are the top 1 or top 2% in population. But, I understand it much more broadly, and, you can read up more on Gardner's theory of multiple intelligences, which will tell you that one could be gifted in the artistic arena, specifically in the musical arena, or kinesthetic, like being a ballerina would have, will be gifted, that way. So all these different dimensions need to be taken into account and the research separately. So there's a lot of these different aspects of giftedness. As I mentioned earlier, giftedness can also actually be associated by some of the more maladaptive or problematic issues as well. And that needs to be researched together in the context of these other problems as well. So, but there's a lot of research on giftedness, and especially what's important to remember is that the multiplicity of the dimensions of giftedness, and also the ability of the individual to turn giftedness in actual performance and outcome. There are a lot of gifted people around when you assess them. I sometimes assess people during difficult times in their lives after a major trauma or accident, and so I can see their life longitudinally, like how it all went. And then in testing, we are discovering that they are of superior or very superior intelligence, but nobody told them because their parents were, not perhaps all that interested in their academic achievement. They had their own issues. They had adverse childhood experiences. They never developed the motivation or the ability to turn their talent and giftedness into reality. So that's why when we talk giftedness, yes, we need to assess it, but we also need to understand how functionally it can be capitalized upon and used in life. Obviously, the earlier the better, but it's never too late. We had clients who were coming, in their 60s, and they wanted to know, what they could do differently for their retirement years, or why they, they feel that they, actually are talented in something, but they never went that way. And why is it so? And they reflect on it. So that's actually a fascinating area, and I invite you to check our website, because it will provide assessments of giftedness from all these different perspectives. Actually, assessment of achievers and gifted people is sort of a special type of unique skill that we have at Cortex. It's very difficult because it's harder to see deficiencies in highly gifted people. They know strategies, how to conceal them, how to compensate for them, how to select activities that provide positive results. And that's why if, for example, someone comes post-trauma or accident or injury, and I am assessing them, they still may score average in everything, but they actually expected to score higher than average based on their overall giftedness and how they achieved in the past. So great question. Any other questions?
There's tons of questions. I don't think we're going to get time for them all. I'm going to ask 2 more that I'm going to sort of pick out of all the questions that have been asked here. There is one person who comments on the fact that some people are debunking the idea of visual, auditory, and kinesthetic learners. And so they want to know, is there a set style of learning, from your opinion? Is there a set style of learning, or is it more a continuum?
It is more of a continuum. And I sort of simplified this whole, visual, auditory, kinesthetic learner to emphasize the preferred style for most tasks. but it doesn't mean that this is a preferred style for all tasks.
Right.
So, you need to know, for example, you may be a visual learner if you're, learning maybe logic or math, but you may be an auditory learner if you're studying literature or something else. So, in our assessments, we try to look at the context. So we don't tell people, hey, you're a visual learner, you're auditory. It's simplifying it. It means you may have a preference, and in the testing, you can actually look at the tests, that they performed well. And, there's something going on in this one modality that they all do poorly at. And that means that's not a preferred style, so that the other style is more preferred. But people's brain is very flexible and adaptable. And depending on the type of task, you activate sort of, different aspects of the function.
How does one go about harnessing the strengths of anxiety and of OCD? Because it seems that to some people that there are no strengths in those two. How does one view the strengths in those? How does one, capitalize on those in the clients that are sitting in front of us?
Right. Well, again, as I mentioned, the priority in those conditions is, of course, therapy, treatment, increased social support. But I wanted to point out that there is this other side which can be harnessed. And in case of anxiety, this is sensitivity to other people. So if you're anxious, you may want to have, positive relationships with people. And therefore, you may be more liked than others. As I mentioned, clients with anxiety perform really well in mental health interventions because, they want to succeed. They want to please the therapist as well. They want to feel anxious. Because they're so sensitive, they may not be as brutal or blunt or arrogant, as or unpleasant as some other people can be in interactions. So, that could be considered a strength. Having said that, it depends, severity of anxiety, what kind of anxiety. Is this sort of more on a social side, or is it like generalized sweeping anxiety, or is it panic attacks? I don't particularly see, harnessing panic attacks, that's a very unpleasant and uncomfortable experience. But what I meant by harnessing anxiety is harnessing that baseline level that is very difficult to eliminate in therapy because it can come back, under stress, and, even though it's not disabling, but it's slightly uncomfortable. And, that's a way of harnessing, or maybe the harnessing is too big a word for it, but capitalizing on some aspects of it, as opposed to someone who is insensitive and does not have anxiety. Also, anxious people typically avoid major risks. And, being risk aversive has its strength. You may have fewer accidents, you may have fewer, bad interpersonal choices. It's a, both psychological and philosophical question in a way, what it is that can help with. So that's on the anxiety side. We need to know more about the nature of it, because I don't want you now to think, oh, hey, I am anxious, but I have all these strengths and I am not going to go for therapy or counseling, because we need to deal with the not so adaptive aspects of anxiety and the stress and pain that comes with it. But we can also normalize it and say, hey, anxiety is so common. 50% of people expect to have some anxiety condition or anxiety symptoms at some point in their life. The prevalence is so high. We are surrounded by anxious people. So, and not everybody can, immediately get help. And very often, given how our healthcare operates, you're going to get a pill, like, hey, swallow an Ativan when you're going through the bridge, when you're afraid you're going through the bridge. So, that's not a solution. So we need a good combination of clinical approach, which is getting help for the most prominent and disabling aspects and getting strategies and techniques that you can use. And then, normalize it to yourself and others, by the choices and decisions you're making in life about your future and about, present situation. So, and the OCD, I think I mentioned in my presentation that having low-grade OCD with high conscientiousness and being very, detail-oriented, very cleanliness-oriented, rule-oriented, organized, and orderly, we probably will all agree that this could be a strength. And many employers would rather have someone with OCD than someone, who, actually does not have these characteristics, and especially in certain types of occupations. So this is always that sort of a warmer look at OCD features. I don't say OCD disorder, it can be very disabling. But OCD features, when it's milder and it sort of becomes more conscientiousness and there is good awareness, then that complexity can be handled.
Okay, so I think I'm going to I'm going to wrap things up here for you, Isabella. I want to thank you so much. That was such a wonderful presentation, and I really like the idea of taking a look at the positive aspects of these, what are normally thought of as disorders, but really looking at, well, but wait a minute, there is a positive side to it as well, and that we really need to harness those and really try to amplify those more. So I really appreciate that stance that you took in this talk.
Thank you. We're complex beings.
We are.
We don't want to be reduced to a disorder with a certain name.